Welcome to This Week in Missouri Politics. The last few elections, you've made change more at the ballot box on referendums than in voting for candidates. So we're here to talk about probably the biggest thing on the August ballot. It's called Medicaid Expansion Amendment 2, and we're joined by Representative Mary Elizabeth Coleman from North Jefferson County. Thank you for joining us.
Thanks for having me.
And Dr. Heidi Miller, primary care physician here in St. Louis. Thank you for making the time.
Thank you.
So you're in support of Amendment 2, and I read your piece. I saw the one in the Joplin Globe. Walk folks through that maybe didn't get a chance to read that. Who will get health care, and what will this actually mean if it passes?
So currently there's 230,000 patients in Missouri that are uninsured and could benefit from this. And the majority of those patients work and either don't have health insurance available to them or can't afford it. I take care of these patients. I've had the same primary care panel for 17 years. And although I do the best that I can as a primary care doctor, those patients without access to knee surgery for a knee injury or a stress test for chest pain, it's very agonizing trying to take care of patients when I don't have the tools available to me to take care of them. And then I see their disease progress and devastate them. When I know that this is a fixable problem, we could intervene and then they could continue
Under Obamacare, I thought there was a penalty if you didn't buy insurance. Did those folks just pay the penalty every year?
So that's currently no longer existing.
Okay. Representative Coleman, you looked at this and you come to a different conclusion on Amendment 2. Break down, I mean, my instinct is if somebody needs health care, your heart goes out to them, mine does too.
Yeah.
But at what point, how much charity can the state afford, I guess is the question.
So it does absolutely come down to the cost for us. There's no doubt that our healthcare system is broken. The costs are astronomical. They continue to get more expensive. But the state of Missouri looked at expansion back in 2014. We decided we couldn't afford it then. We can't afford it now. And it's not that we don't want those people to get health insurance, but Missouri does already provide a really robust safety net for our most vulnerable citizens. And so about 40% of our budget is going to the Medicaid program. Without expansion by 2023, all of the studies are showing it just continues to get more and more expensive. And we're going to have to do something differently and expanding it while we're having these budget cuts. I just don't know where the money's going to come from.
So who would treat these people, if this 250,000 people, if they don't have a Medicaid expansion that can go where the government just does it for free?
So right now, the way that works is they would present as an emergency into the hospital system, or they'd go through one of the qualified federal health clinics.
And when you go to the hospital, though, who pays for that?
Well, the insured do, the uninsured do. The costs continue to rise, but this is not going to fix that problem. It's really not. Everybody sort of says, listen, we're going to go ahead and make sure that every person has access to health insurance, but all of the projections that I have seen, for healthy adults to get health insurance through this process, it hasn't worked in the other states that have done it. And in fact, if you look at Oregon passed this ballot in 2018, and then in 2019, they added work requirements for everybody in the state. That if you were a healthy adult, you had to be working because they realized they couldn't afford to do it.
Is that something that would make you consider supporting this?
I mean, if this passes, we're going to have everything on the table, including rolling back provisions for the most vulnerable. So right now, Missouri provides for our children in the state access to Medicaid at 300% of the poverty level. That's not required federally, but Missourians care about children's health. We care about the most vulnerable. And if this passes, I don't see how we continue to do it at that percentage. We're going to have to see it roll back. And so if you'd rather have it go to healthy adults than to kids, that's a reasonable policy disagreement that we could have, but I'd rather see it go to the most vulnerable.
I don't know. I think there are folks, though, that they might qualify for Medicaid now. They just don't know it. I mean, I think there's a lot of people that, even if this passes, they're not going to understand they can go get free health care. How do you connect some of the folks that would qualify for this? Maybe they're not watching this show. Maybe they're not reading the Post-Dispatch every day. How do you connect those folks to even know this exists?
So that's a minority of patients, and we want to encourage all Missourians to have a primary care home where they can have preventive care and they can have management of their chronic disease, and any medical facility should help a patient find those resources. And at this point, we actually don't have to rely on projections because there's 37 states that have expanded Medicaid. And the data shows there's been over 400 studies of Medicaid expansion. There's been 24 on the economic impacts. Every single study has shown a benefit to the state revenue. Montana earned $50 million in savings the first year. Virginia, $400 million in 2019 documented. And the Association of the State Budget Offices has accumulated this data of the states that have expanded Medicaid.
Yeah, I saw Oklahoma just voted this, and the Prince of St. James made sure everybody knows, Jack Cardetti knows everybody in Missouri knows Oklahoma did. But walk me through here. So I've had a lot of people come on the show, and they'll say there's going to be a net benefit. I'm from the Boot Heel. I kind of believe you in the Boot Heel. There may be a benefit on day one. The more government money that's spent, generally we benefit. It's just the way our state's set up. Tax revenue goes from places like we're in right now and goes to places like where I'm from. And we don't like to admit it, but it's true. However, overall for the state, I've heard people say, yes, this will be revenue neutral. There'll be savings in year 3, year 4, some year 2. Heard some folks say year 1. Do you really think the state could budget and bet school kids' tablets and teachers' salaries on that there'll be a net revenue that's neutral in year 1?
So this is an investment in the future of Missouri.
Yeah, I agree with that.
It's a sound economic policy. The economic benefits are plain. And in the other 37 states, of those states that have been studied, there has been no detriment, and this has been documented in multiple studies, including the New England Journal of Medicine, which is the most prestigious medical journal, that it has not pulled from transportation and education. And there are reasons for that, and I can explain.
The medical journal, though, probably is pretty keen on more medical care, right?
That's right.
Now, let me ask you this.
Well, can I just say really
Yeah,
quickly
sure.
to respond? The rest of the story to that is that according to Missouri Foundation for Health, when they do their survey of other states have enacted health insurance taxes for managed care plans. So that means most Missourians currently are covered either under Medicare, our children are covered by Medicaid, but most adults, by and large, are covered by managed care plans by our employers. So that means the average tax is a 1.5% tax rate of our health insurance plans that is allowed to be passed on to consumers. So I don't know about you, but the last time I heard a Democratic fix for Obamacare saying we're going to bring down the cost of health insurance, that was not my experience. What I saw was increased cost. And it's true, the other states that have expanded Medicaid have not seen a revenue hit across the board, but that's in large part because they have whittled down benefits to those currently covered, and they've increased taxes
Well, the
on
fact there's only
managed
so
care
much
plans.
money, right? I mean, let me ask you this. This
doesn't
comes
come
down
from
to the
nowhere.
question. She said, Dr. Miller said, an investment in the future. I tend to believe that, especially in rural Missouri.
Yeah, you can make a real argument that healthy adults should be provided health insurance by the government. We can have a different a decision about that. I don't think that the government's role is that. You may think it is. There's no doubt that people's health would improve. But where do you get the money from,
So it's
and
a
at what
90-10
cost?
split for the state to come up with that 10.
That's
Maybe there's revenue increases in year 2, 3, maybe. But for year 1, if it's a shortfall, as some folks have projected, the
Right.
House Budget Chairman
That's
projected that. Where's that going to come from?
I don't know. I mean, that's really the answer, is I don't know where that money will come from.
Okay, so the initial sticker price is only that. It differs greatly from the actual fiscal impact of Medicaid expansion. And the reason is
That's actually a really good point that you
there's
brought up.
3 points. There's 3 reasons. Currently, because with the Medicaid, number 1, we will save on costs for traditional Medicaid because we are currently paying a 35% state share, and that would change to 10%. Number 2, currently the state of Missouri is covering the health care costs of uninsured patients, including specifically behavioral health costs, substance use disorder, and when patients are incarcerated in the state of Missouri and they become hospitalized, which are the largest health care costs, the state swallows the cost of that. So each of those populations could be converted to Medicaid expansion, and then Missouri would go from paying 100% of those costs down to 10%. The third reason is that there would be a reduction in uncompensated costs as well as an increase in revenue from increased economic activity.
So Dr. Miller just hit on a key point. She talks about the overall impact to the state economy, and that's a really different question that you and I are talking about, and that's the state budget, right? And so there will be more money for hospitals. Why do you think the hospitals are pouring hundreds of thousands of dollars to promote this? Why are physicians? They will have more money in their pockets. That's true. But you're going to have to get that 10% from somewhere. It doesn't just come from nowhere.
Well, let me ask you this. I mean, this isn't a year 1 thing, but if you do hire a nurse or a doctor, it's going to be good. Those are good jobs. If you hire,
That's right.
generally hospital jobs in a lot of rural areas are some of the best jobs you can have.
That's right, and we want our rural hospitals to continue to survive
You
and
put a
thrive.
hospital in, though, like in Poplar Bluff, folks from Greenville, Donovan,
That's right.
Oxley, Cooter, they're all going to come to town. They're going to eat at Las Margaritas. They're going to go get gas. They may stop at the store at Orscheln and get them something to take home. There is economic activity around hospitals.
That's right, absolutely. But that's separate and apart from the question of the 10% share that the state is going to have to pay, and
So
where is that going to come from?
Right now
and
we're
right
paying
now we're not
35%.
So not across all of those populations.
Correct. It's for
And when
pregnancy,
you look
blind, and disabled.
That's right. And so look at the numbers of what that percentage is. And I hear that the physicians are really wanting to push this. I understand why they are, but I would rather listen to the state treasurer, the budget chair of the House and the Senate. When you talk to the people who work for the taxpayer, who are going to have to make these decisions about, do I want this money to come from this place or this place? It's really hard. I tell you, when we went back into session to do the emergency budget, I sent out a survey to my constituents and said, we're going to have budget cuts. We're looking at a $750 million shortfall because of the shutdown that happened around COVID. Where would you take that money
The
from?
folks in Jeffco say highway patrol and liquor control,
What they said,
conservation agents.
what they said across the board was save education and save our roads. Nobody said anything about where they would take that money from. And of course, no one wants to cut any of those programs. We want to have a robust state. We want to have a robust economy. But the states that have expanded this have had to either increase taxes, which increases the health insurance costs for most Missourians who are currently covered, and they put more restrictions on the plans that are already there. I don't see how we continue to afford to provide 300% of the federal poverty level for our children and allow it to be there for healthy adults.
I think, you know,
I really like that policy point because it is true. Medicaid eligibility in Missouri is so confusing.
Yeah.
So first of all, you can't just get Medicaid if you don't have a job. You have to fit these categories, and you have to be a parent or pregnant or blind or disabled, et cetera. And yes, you're correct.
Well,
So
actually, pregnancy isn't a triggering event, which is one of the things that I've worked to try to change. So just as an aside, keep going.
So with children, Medicaid does allow 300% of the federal poverty level. But here's what happens to the same thing for a pregnant mother, but 60 days after a woman gives birth, her eligibility goes down to 22%. And this is logical. However, there's a robust medical literature to show that that the health and the insurance status of the parent directly influences the health of the child. So I think Missourians, you're right, we truly care about our children. So that 300
And pregnant women too. I mean, there's been bill after bill to try to
Yeah.
extend.
Well, you
I
keep going back
sponsored
to
it
it's an investment in the future.
to
right?
expand that
Yeah.
for that first year. We have an incredible problem with a black
It sounds like
mortality
the
rate.
balancing effort here is an investment in the future versus how do you pay the bills next year, right?
And now we're actually,
Absolutely.
when we think about perverse incentives with our current system, let's say a pregnant woman currently can have Medicaid if she earns less than $36,000. 2 months later, she loses that pregnancy postpartum status, and then she becomes a parent, and she has to earn $3,000 or less in order to have Medicaid. So when she's trying to go back to work, she realizes that if she earns $1 more than that $3,000, she's going to lose her health insurance. And if mom is not insured, and if she's not healthy, the child's health suffers.
And
I think
that
we can
first year
all,
postpartum
we can all
is really
agree that
important.
if this passes, we'll have a lot of discussion about how to implement this. Hope both of you will come back and
Yes.
join us and talk about it then.
Yes.
We'll be right back with our opinion maker panel. We'll have former Senator Jim Lemke join the show after this.
Mark Mantovani alone took on the corrupt machine. Now he'll finish the job. Mark Mantovani. He built a national business creating nearly 800 good-paying jobs. And during the last recession, Mark cut his pay in half to save jobs. The only candidate for county executive with the experience to rebuild our economy after COVID and create a more equitable county with more opportunity for everyone. Career politicians haven't gotten it done. Democrat Mark Mantovani. Real leadership for a change.
Your energy needs are changing. That's why at Ameren, Missouri, we're not waiting on the future. We're building it with the Smart Energy Plan, advancing thousands of projects across the state, helping reduce emissions through cleaner energy sources, boost reliability with self-healing equipment, and better withstand storms with new composite poles. Moving Missouri forward and bringing us all a little closer together. That's energy at work. Ameren, Missouri.
Mike Parson served in law enforcement for 22 years. A former sheriff, Parson is tough on crime. Governor Parson is standing up for victims, investing in better mental health services, and cracking down on violent crime and drugs. Governor Parson's anti-crime initiatives have led to the arrests of hundreds of violent criminals and gang members. A former sheriff, a conservative, tough on crime governor. Mike Parson is making Missouri families safer.
Every year, billions of our tax dollars go to Washington, D.C. And those tax dollars, where do they go? To 37 other states like California and New York to pay for their health care. Amendment 2 would fix that. By expanding Medicaid, Amendment 2 would bring our tax dollars back to Missouri to protect thousands of healthcare jobs, help keep our rural hospitals open, boost our economy, and deliver healthcare to more veterans and hardworking Missouri families. Vote yes on Amendment 2.
Welcome back this week in Missouri Politics. Opinion Maker panel time, a little socially distanced panel. Jesse Lawler with Planned Parenthood, correct?
Yes,
Welcome
that's right.
back to the show.
Thank you.
Stephen Roberts, a representative in St. Louis, running for state senate. How's the campaign going?
It's going very well. Thanks again so much for having me.
Let's talk about something that we just got to see. I love the discussion we had in the previous segment because it was an intelligent discussion about Medicaid expansion. You read Twitter, some people love it, the other it's terrible. Stephen Roberts, I mean, you've actually ran for office before. I think they're going to win by a sizable margin, right?
That's what it looks like to me. I mean, I think Missouri's finally ready to do it, and Missourians want it.
Do you think that's the case, or do you think it's the case where one side has a campaign, the other side doesn't?
I think that genuinely most Missourians want this to happen.
Jesse, is it because one side has a campaign because there are groups for it, and the other side doesn't have much of a campaign because there's not many people for it?
I don't think those two questions are really a different question. I think the reason why there's a campaign for it and not a campaign against it is because there's a recognition that people want it.
I mean, you got the state chamber, you got the Catholic Conference, you got ARP. I mean, a lot of the groups that follow this stuff have signed on to this. As a person that's always a little bit nervous when the government starts spending more money, it does look from a political standpoint this wins. Will people like this? And let me ask you the question. You're going to get asked, where's this money going to come from?
Well, I think the clear issue here that people are overlooking is that the vast majority of this money is coming from the federal government. Not only that,
sure,
but the vast majority of that federal government money is money that we're already paying. So right now, Missourians are paying for other states to expand Medicaid. Now we want to bring some of that money home, and I think people will respond that way.
All right, now, I worry sometimes. I think Medicaid expansion is probably a good thing. I think in a lot of parts of this state, parts where I'm from, it's going to be good on year one. For the overall state budget, I could buy your argument that it's going to be good in year 3 or 5. You're investing. You're going to cut overall health care costs by treating things up front, like the doctor said. I get all those things. But in year 1, you tell them it's going to be revenue neutral, Representative?
Well, I think it's an investment, in the future. In the long term, it's going to save us money over time, and that's what we want.
Year 1, they'll have a pig in a poke trying to sell me. You tell me in year 1 it's going to be neutral.
Listen, I think you have to look at things like education and the amount that we spend on education in this state to look at what Representative Roberts just said, which is we're investing in the future.
Where are you going to bring that money at? I mean, I want to invest in the future too. I'd like to go buy me a new F-150. It'd save me on gas a little bit. But I got to worry about how to make the payment next month. Where are you going to take the money from in year 1?
Well, we've got 163 smart people in the House and 34 in the Senate that are going to be talking a lot about
Somewhere
that.
Harry Truman saying the buck stops here. Just rattle a little bit. Where are you going to bring that money? You got to bring it out of education, right? There's no other place to bring that kind of money out.
It's hard to say right now, but especially with the pandemic and everything, I'm not sure what our budget's going to look like next year.
It's going to be slim to start with, right? I mean, There's no other way to look at it. You're going to be short money. Let's talk about some of these races. You were in a race with 2 other opponents in St. Louis. One of the most unpredictable districts they drew last time, another 3-way primary when Senator Nasheed won. How are you going to win that race?
Right, actually, well, there's 5 other candidates now, so it's a pretty crowded field.
Wow.
But I mean, yeah, we've got a great team in place. It's just been a really interesting time trying to run a campaign in the background of the pandemic, trying to keep folks safe. So a lot of times,
Michelle Sherrod's running, Alderwoman Megan Greed's running. You've been testing folks for COVID, right?
That's right, for over 2 months now. Wow. So I found out that the 63113 zip code has been one of the most devastated areas by the virus, and there were no testing centers in the area. So I was able to reach out to Affinia Healthcare, Dr. Kendra Holmes, and Joe Palm, who's the chief for the Office of Minority Health, and we were able to set up a weekly mobile testing site at the Victor Roberts building. And every week, this past week, we tested close to, if not more than 200 people.
It's interesting. The state senate's where that real policy gets made. If you can get those things through, it's not just do you vote, it's do you let a bill come to the floor and be voted on. You've got a lot of Republican races around the state, and it's going to be interesting. Some of those folks, I always think you're not a senator if everyone's against the PQ, right, when you in debate. But you're not a senator if you're against the PQ, but you're for the PQ on my pet issue. It's going to be interesting to see who comes out of these Republican primaries and how that'll shape the policy as much as anything in the state.
I think that's absolutely right. If we go back to some of our previous discussions, I think what we're looking at in implementing Clean Missouri is really looking forward, something that could be impactful in the state Senate races and could help to allow a more, let's say, pragmatic set of senators to walk in there and get things done.
Big fan of pragmatism. But let me ask you this. I've heard voting on Clean Missouri again is bad because they already decided on it. Well, Missourians voted on an Obamacare thing in 2014. It went down in flames. Now they want to vote again on Medicaid expansion. I think it's going to pass, but I've not found Amendment 2. I don't see a campaign against it. I don't know what it hurts.
Well, I think the big issue that people are dealing with with Clean is that voters were very intentional. I think every state Senate district in Missouri passed this.
I think they passed an ethics bill that had some map drawing in it. Doesn't mean it wasn't a good play, wasn't smart. I'm not sure folks read, I'm going to definitely vote to change how my state rep line is drawn.
So if the argument is that people didn't know exactly what they were voting on to begin with, this new proposal doesn't change that in any meaningful way.
When Lincoln Huff voted against it, I thought, you know what? Your best argument was you were selling one thing and you were getting two things, one kind of in the back door. Republicans are doing the same thing. I thought that was their best intellectual argument. Politically, I don't think it's going to matter. I mean, Carl Bearden's going to owe me a beer, I think, on how much it goes. See, remember, if you were drawing the lines on Amendment 2, though, or on Clean Missouri, so you draw the first set of lines, and you might draw them a little more Democrat, sure. People expect that. But after 2 statewide votes, you can maybe get that pencil to work, right? I mean, I think it may embolden folks.
Yeah, it's that's definitely something that our democracy has struggled with. You want fair maps and representation.
Speaking of democracy, I really believe if you watch the video of George Floyd being murdered and the cavalier attitude of the person that had their knee on his neck, if that didn't touch you in a way that whatever your views were before on these issues had to shake you a little bit. You've been pretty active in police reform. Now, I hear defund the police. That ain't real life. That ain't going to happen in Missouri. But what are some things that could happen that could prevent things like that from ever happening to anyone again?
Absolutely, and one of the most frustrating things for me is that we finally have a video, but this isn't something new. These things have been going on since before I was born. But just briefly, a few things that I think we could do would be creating a mandatory requiring officers to intervene and disclose situations where they view excessive force. Just like me and all my other colleagues who are elected officials, if we see something inappropriate happening, we're required to report it, and if we don't, we can be penalized for it. So I think if we're telling our officers, look, if you don't disclose, if you don't intervene, you're going to be treated like you were complicit in the act. And that'll encourage, I think, newer officers as well to stand up and say something because they're realizing, look, this person's bad behavior.
Well, everyday citizens, right? If your buddies are doing something and you're swept up in it, you get in trouble too, right?
Absolutely.
And I don't know why you should be a favored citizen because you have a badge.
Definitely, and our law enforcement officers have an immense amount of power. I mean, that's the privilege they have to arrest someone, take away their liberty.
Don't you think at the end of the day, if you don't make the officers part of this, cops aren't going away, and nor do rational people want them to. I think you're going to have to make them part of the solution. Maybe give them incentives like with teachers. Right now, if you're a teacher, you go get your master's, they pay you more. Maybe that getting social work training, de-escalation training, give people, let the market work, a financial incentive. I think cops would, if you make them part of the solution, that's the only way to really accomplish anything. Am I wrong?
I think there's some viability to that argument, and I think what you just said about social work is really important because I think one of the main problems that we have in looking at the criminal justice system and police reform is we look at these things often in a policy bubble, and we ignore a lot of the intersectionality and frankly the root causes of some of the activities that people are ending up in the criminal justice system for. And if we looked at much more comprehensive, bold, innovative, frankly, some might call it Pollyannish, but you look at the system as a whole, we have structural racism and white supremacy baked into every fabric of our society, and until we can start to root those things out, police reform isn't really going to solve the problem.
But, I mean, you appropriate money. To me, I think it's a fair point. Maybe there's a lot of folks in county jail right now, in Iron County, that they have a head problem. That maybe if you help them with some of their mental health issues, you wouldn't have to put them up room and board in Potosi for 5 years later on down the road.
Right, and same with drug offenses as well. I worked in the city as a prosecutor. more money and funding for our drug treatment programs and diversion programs, differentiating folks who are actually going to be continued problems to society and those who can be rehabilitated, made a mistake, and deserve a second chance.
Saw both these fellows come in with masks. I saw Nicole Galloway come out and make part of her campaign to get folks to wear masks. Now, I noticed she didn't come out and say the government ought to order you to wear masks around, but I thought that was kind of an effective way for her to persuade people.
Well, I think one of the things that her campaign is really focused on right now, and frankly, I think campaigns across the country, just because of the year it is, are looking at a real dearth of leadership from the top, from the president, all the way down to the governor in terms of...
Do you think it's a lack of leadership when the government decides not to do something? A conservative leader trust me, Parson will go to a press conference, every urban paper will bang on him, why don't you order, why don't you tell people what to do more? It takes more guts to stand up to the mob than it does to go with them.
Well, sometimes it's not just a matter of making orders and proclamations. Sometimes it's about getting the right tools and information in people's hands. And my observation of Government Parson throughout this is that he's been a step behind at every level. We were late to start ramping up testing. We were late to start stay-at-home orders. We were late to close schools.
Folks on the second floor won't want to admit that a lot of that comes from the federal government. If there's no tests around, you can't ramp them up. But I do have to stop now because with a minute left, who won the week?
Representative Derek Guyer, on Friday, the governor signed his bill, House Bill 2046. Unfortunately, it was one of those loaded up bills, but there is some great stuff in it, like the Fresh Start Act.
Who won the week?
Nicole Galloway, without a doubt. Last week, we saw one of the major publications shifted her race from likely Republican to leaning Republican. This week, she came out with some really impressive fundraising numbers, and she's got a lot of tailwinds.
Help Governor Parson take Donald Trump's Twitter account away, I think. That's the thing you can do. I'm going to say one of your colleagues, Crystal Quaid. I'm an old staffer myself, old House staffer. I don't know the particulars. I don't engage with the Twitter trolls much, but I will say, I thought it was nice sticking up for a staffer. If I was a staffer working at the House like I did it way back a long time ago now, I would have liked the leader to stick up for me. So I'll say she won the week. Hope you'll win the week next week on This Week in Missouri Politics. There'll be a different host next week. I'm heading to Florida. He'll have much better hair. You'll enjoy it. See you in 2 weeks.
This Week in Missouri Politics, sponsored by the Missouri Association of Career Fire Protection Districts, Spire, and Sterling Bank.
Mike Parson served in law enforcement for 22 years. A former sheriff, Parson is tough on crime. Governor Parson is standing up for victims, investing in better mental health services, and cracking down on violent crime and drugs. Governor Parson's anti-crime initiatives have led to the arrests of hundreds of violent criminals and gang members. A former sheriff, a conservative, tough on crime governor. Mike Parson is making Missouri families safer.